Hi, my name is Adam. I will be demonstrating how to administer medication IV push through a pick. So before entering my room, I'm going to look at my MAR here. I have Bob Owens. His date of birth is 9/22/1933. He has an allergy to morphine. He is admitted with pneumonia, has lung cancer. I went in, did a pain assessment because he's complaining of he's getting sharp pain when he coughing. Rates it an 8 out of 10 using a numeric scale. So now that I have that information, I also see that he was born in 1933. This is a lifespan consideration. I'm going to pay close attention to adverse reactions because elderly are more prone to adverse reactions with medications, especially narcotics with respiratory depression. So I'm going to gather my supplies. What I need is I have sodium chloride. That's going to use these for my flush and also to dilute my hydromorphone. I have hydromorphone. I have a 3 milliliter syringe to draw out my medication with a vial access device to help do that as well. I have alcohol swabs, some tape to label my hydromorphone, gloves, a buddy book, drug book, tape, hand sanitizer. So, first things first here is we're going to make sure when we're getting our medications ready that we're going to check expiration dates. I got my hydromorphone, expiration's 12/2030, so that's good to use. All my sodium chlorides are 3/2020. Good, so these are not expired. We're able to use these. Also what I did is that I had already removed any air out of here to prep them for when I take them into the room because we don't inject any air into our patient. So, wash our hands. Let's put on a pair of gloves. We're going to get... So, what I had done is that I see that I looked up at MAR. It says that I'm going to give this hydromorphone IV push. So I looked up in my drug book and it says to dilute it in with normal saline. I checked my buddy book. They are compatible. I'm able to use that together. Also what it says is that you need to dilute your hydromorphone in at least 5 milliliters of normal saline. So we'll make sure that we get rid of a little bit of fluid here, a little bit of saline, so we can have enough room to dilute that. Also, it wants you to administer your diluted medication between 3 and 5 minutes. Okay, so we're just going to get rid of a little bit of water here. Make sure that our medication can fit in here. So that's good. We got that ready. So next what we're going to do is we're going to get dose accurate. So what we have here is we have 2 milligrams of hydromorphone per 1 milliliter. Okay, so I did my math, and what it asked for is 1 milligram IV push. So when I do my math, it's 0.5 milliliters per dose. Okay. So what we're going to do is we're going to clean off our top. We're going to get clean our vial. I'm just going to draw some air back. Good. Inject air into our vial. Going to get dose accurate. Okay, so if you can see, we are at exactly 0.5, which is a half a milliliter. Good? Okay, so now that we're dose accurate, I'm going to do my 5 rights here. Okay, so I see that I have Bob Owens. He has an allergy to morphine. He's getting hydromorphone. He gets 1 milligram equals 0.5 milliliters. IV push every 3 hours for pain. So we have Bob Owens. He's getting hydromorphone. 1 milligram equals 0.5 milliliters. IV push every 3 hours, PRN for pain. And we're getting this at 2:45. Bob Owens, he's getting hydromorphone. 1 milligram equals 0.5 milliliters. IV push every 3 hours, PRN for pain at 2:45. I'm going to do that one more time because I skipped my time on the first one. So we have Bob Owens. He's getting hydromorphone. 1 milligram equals 0.5 milliliters. He's getting an IV push every 3 hours, PRN for pain at 2:45. And he hasn't had this medication yet. We're okay to give it. Okay, so now that we're dose accurate, we can use that, what I made a little area to be able to put our medication in to dilute it. Okay. Good. So we're going to get it out any extra air here, like so. Again, we'll put this back on. Make sure that I don't mix up with my other flushes. We're going to label it. So here we're labeled with our hydromorphone here to make sure that we know we can distinguish it from the rest. Good. Okay, so now that we're dose accurate, we have everything that we need here. I can go inside the room, okay, and meet our patient to administer our medication. So, knock knock. Good morning, Bob. My name is Adam. I'll be your student nurse today. Before we're going to be giving some pain medication, okay? I see that, from our earlier assessment, you had a pain 8 out of 10, okay? So can I get your full name and date of birth? He tells me 9/22/1933. We look at his armband, it checks out. Bob, I see you have an allergy to morphine. Do you have any other allergies? He says, nope, just the morphine. So I explained to him about the medication, that it can cause drowsiness, maybe a little upset stomach, and he complies. He says, okay. I'm able to assess him to make sure that he's able to, follow any commands and whatnot. So he's able to do so. All right, so first things, before we administer medication, we're going to look at our PICC site here. So sometimes the reason why that people have PICCs is because they don't have any access to any peripheral IV sites. They might be getting dialysis, they might be getting long-term antibiotics, or they might have multiple medications that they need different lines for. So here we are. So, all right, Bob, so we're just going to give ourselves some, we're going to close the door here because I'm going to give you this medication here, okay? Very good. All right, so let's get some gloves. Okay. So let's assess our site here before. All right, so we're looking for any maybe tenderness, what's the signs of maybe phlebitis or infiltration, looking for any redness and indicating an infection. Everything looks great. Okay, so first we're going to get our area. So we're going to use what our facility wants here. We're going to use this white line, which is for medications, okay? So here, and then you want to use an aseptic cleansing solution, which our facility asked for alcohol swab. So 15 to 30 seconds also is what they want. So we're going to clean 15 to 30 seconds. We first are going to flush. So we're going to open up our line like that, attach, 15 to 30. Nice and slow here. Okay, we got that all in. We can release. We're going to clamp. Like so. So next is we have our medication, which is diluted here. And so we're going to clean our site again. Okay. So here, we're going to attach, we're going to reopen. Okay, so we're going to give this over 3 to 5 minutes. And during this, or I'm going to be watching Bob for any adverse reactions that I had mentioned, paying close attention for lifespan consideration due to his age. Ask him how he's doing. How you doing, Bob? He says he feels fine. He's not drowsy. I can watch his monitor, look for his pulse maybe be dropping at all for an adverse reaction over this 3 to 5 minutes. So he is okay. We can be obviously looking at a clock or looking at a watch. Either way is fine. So after that is completely in, but 3 to 5 minutes, we're going to release. We're going to clamp. Okay. Here we're going to clean. Then we're going to do our last flush here. Okay. So last flush. We're going to do first 30 seconds. We don't want to bolus. We're going to unclamp. We don't want to bolus that medication in. So first 30 seconds, we're going to go real slow. And then the remainder, we're going to pulsate. So let's say it's been 30 seconds. Since it's through a pick, we're going to pulsate the rest in. This helps keep anything from building up in this long line, peripheral line here, this pick. So that's all done. We're going to clamp, release. Maybe your facility has you put a chlorhexidine impregnated cap on there. Our facility doesn't. You could give it another wash if you want. It's really not that necessary because you'll be washing it the next time you administer medication. So I'm going to reassess. I'm going to take off my gloves, ask Bob how he's doing. How you feeling, Bob? He says he feels all right. I'm going to clean up my area, wash my hands. So we're going to, I'm going to make sure of safety, make sure call light, low bed, floor mat, letting him know that this, again, to remind him about it could cause drowsiness, to make sure he uses his call light, make sure the bed alarm's on as well. I'm going to document, obviously, our site, how it looked, but also our pain assessment, where it hurt, how it hurt, obviously the chest pain, 8 out of 10. We're going to do date and time that I gave him his medication. Also, I'm going to chart that pre-assessment vitals, and then you do post-assessment vitals after giving him his medication. So reassess those vital signs again to see, you know, how he's reacting to this medication, looking for those adverse reactions. I cleaned my site. That's it for my video.